Did you know that your pretty tattoo could stop you from getting an MRI medical treatment? Welcome to Fact Check channel. If you haven't subscribed, please do. Before we start, we need to understand what tattoos are. A tattoo is a form of body modification made by inserting tattoo ink, dyes, and/or pigments, either indelible or temporary, into the dermis layer of the skin to form a design. Reasons why people tattoo their bodies is simple: for self-identity and self-image. Tattoos can boost self-esteem and confidence. Some people believe that tattoos mirror their inner feelings, which can be a crucial aspect of identification. Some find that tattoos can give them a sense of belonging or allow them to express who they are as individuals. Today, people choose to be tattooed for artistic, cosmetic, sentimental/memorial, religious, and spiritual reasons, or to symbolize their belonging to or identification with particular groups, including criminal gangs, see criminal tattoos, or a particular ethnic group or law-abiding subculture. The actual process itself consists of a tattoo needle literally injuring your skin to design the art. The needle also inserts small amounts of color pigments. If your skin heals correctly, you're left with beautiful, permanent skin art. However, the major dangers of tattoos drawing come with the ink components, the metals. What kind of metal is in tattoo ink? Titanium and aluminum are often used as colorants in tattoos. More worrisome, inks using non-metal colorants may include traces of antimony, arsenic, beryllium, chromium, cobalt, lead, nickel, and selenium. Tattoo risks and side effects. Most of the risks and side effects from tattoos occur when the tattoo is still fresh. At this point, your skin is still healing, so proper aftercare is necessary to prevent complications. 1. Skin infection. While tattooing is an art, the actual process is technically one that causes injury to your skin. This includes both the upper, epidermal, and middle, dermal, layers of skin. Your skin needs to recover after you get new ink, so your tattoo artist will give you tips on how to prevent infection. An infection can also occur if non-sterile water is mixed with the ink before injection. You're most vulnerable to a skin infection from a tattoo within the first 2 weeks. Symptoms include redness, itchiness, and discharge. The area may also become swollen. If the infection spreads, you can have other symptoms, such as a fever. In severe cases, infections can be chronic, ongoing. 2. Allergic reactions. Some people might develop an allergic reaction after getting a tattoo. This is usually related to the ink, especially if it contains plastic, and not the needling process itself. According to the Mayo Clinic, red, yellow, blue, and green pigments tend to be the most allergenic. Symptoms of an allergic reaction from tattoos can include a red rash, hives, and severe itchiness. Swelling can occur too. These effects can occur years after you get the tattoo. 3. Keloid scarring. Tattoos have the potential to scar. This is especially true if your tattoo doesn't heal properly, or if you have an infection or allergic reaction. Eventually, you can also develop keloid scars. These consist of raised bumps that contain old scar tissue. 4. Sterilization of needles. A reputable tattoo artist will use sterilized needles. Many states require the use of sterilized needles by law, although this can vary by state. Not using sterilized needles increases your risk of infection and can also pose the risk of transmitting blood-borne illnesses, including HIV, hepatitis C, and methicillin-resistant. 5. Can hide skin cancer. Another risk of getting a tattoo is that it can hide possible signs of skin cancer or another skin condition. These include the telling moles, red patches, and other signs that might be associated with a skin issue that could go undetected. 6. Complications with MRI. What is an MRI? Magnetic resonance imaging, MRI, is a non-invasive imaging technology that produces three-dimensional detailed anatomical images. It is often used for disease detection, diagnosis, and treatment monitoring. Tattooed patients undergoing magnetic resonance imaging, MRI, can develop cutaneous complications during the procedure. Symptoms are abrupt and painful with fast onset during MRI, sometimes requiring termination of the procedure. Clinical signs are absent or manifested as inflammation sensed as burning. The MRI machine changes magnetic fields and causes an electric current to develop into any type of metal. That's why patients may have a burning sensation or pain, because that metal in the tattoo is believed to begin to heat. Tattoo size and location matter as well. A large tattoo could cause the whole area to be affected during the imaging test. And, in the case of permanent makeup, eyeliner that contains dark iron oxide could cause a lot of discomfort and possibly some low-grade burns of the eyelid. Beyond the possibility of burning sensations, the tattoo's location could also interfere with the imaging results. For instance, if there's iron oxide in the tattoo, the doctor can see that there's a black spot overlying the skin and the tissue. The iron simply causes the signal from the body to be distorted. Tattoos and blood donation. If you have a tattoo, you can only donate blood if you meet certain criteria. A good rule of thumb is that you may not be able to give blood if your tattoo is less than 3 months old. This goes for piercings and all other non-medical injections on your body, too. Introducing ink, metal, or any other foreign material into your body affects your immune system and may expose you to harmful viruses. This can affect what's in your bloodstream, especially if you got your tattoo somewhere that isn't regulated or doesn't follow safe practices. If there's a chance that your blood has been compromised, the donation center won't be able to use it. Giving blood after recently getting a tattoo can be dangerous. Though uncommon, an unclean tattoo needle can carry a number of blood-borne viruses, such as hepatitis B, hepatitis C, HIV. People with new tattoos have traditionally been advised to wait a year before giving blood in order to reduce their risk of unknowingly transmitting these viruses. Tattoos removal. Tattoo removal is a procedure to remove permanent ink from your skin. If you have a tattoo that you don't want any longer, your healthcare provider might suggest a type of tattoo removal, like laser therapy. Tattoo removal by a dermatologist is safe but may have side effects like scarring. A tattoo is a permanent form of body modification where an artist injects inks and pigments, dyes, into your skin. Tattoo removal is a procedure to remove this permanent ink from your body. Normally, your immune system works to remove foreign particles from your body, but ink particles are too big for your immune system to remove, which is why they're permanent. Tattoo removal can be a complex process that can take several sessions to complete. This happens because permanent ink granules from professional tattoos exist below your skin's surface. There are several options for tattoo removal, with the most common being laser tattoo removal. If you're interested in removing an unwanted tattoo, talk to a healthcare provider or a dermatologist to see what your options are for removing it. How does tattoo removal work? Each type of tattoo removal works differently. The goal of tattoo removal is to break down permanent ink particles into smaller particles that your immune system can safely remove from your body. This is how laser tattoo removal and tattoo removal creams function with a lower risk of scarring. Dermabrasion, chemical peels and surgical excision focus on removing skin or layers of skin that have permanent tattoo ink particles. This allows your skin to heal around where a tattoo used to be to make it look like the tattoo was never there in the first place. This usually causes scarring. Does tattoo removal hurt? Depending on what type of tattoo removal you choose, there may be varying levels of pain or discomfort. Some people say that removal feels the same as getting a tattoo, while others liken it to the feeling of a rubber band being snapped against their skin. Your skin may be sore after the procedure. Certain procedures are painful, which is why your surgeon may give you general anesthesia or a dermatologist will apply a topical or inject a local anesthetic to your skin. Why do people get tattoos removed? Everyone has their own reason for wanting to remove a tattoo. Some of the most common reasons include 1. You don't like your tattoo anymore. 2. Your job doesn't allow visible tattoos. 3. Your tattoo reminds you of someone or something that had a negative impact on your life. Who therefore, is a candidate for tattoo removal. You might be a candidate for tattoo removal if you 1. Have a tattoo you want removed. 2. Are in good health. 3. Don't smoke. 4. Have realistic expectations for the procedure. 5. Understand the risks and possible side effects of the treatment. What are the types of tattoo removal? There are different types of tattoo removal available, including 1. Laser tattoo removal. Lasers are focused beams of light directed onto your skin. Lasers heat up the ink particles in your skin to break them down into smaller particles, which are easier for your immune system to remove. It can take multiple laser therapy sessions to remove a tattoo. 2. Dermabrasion. Dermabrasion is a type of surgical procedure where a special tool removes the outer layers of your skin that contain tattoo ink. You'll need a local or general anesthetic for this procedure. After the procedure, you'll have an open wound on your skin that needs to heal. 3. Chemical peels. Chemical peels use chemicals like trichloroacetic acid to remove permanent ink from your skin. A provider will apply the chemical to your skin, which will cause the outer layers of your skin to peel. 4. Surgical excision. A surgical excision is a surgical procedure to cut out the skin that contains a tattoo. A surgeon will stitch your remaining skin together after removing the tattooed skin. This procedure works well with small tattoos and isn't effective for large tattoos. 5. Tattoo removal creams. Tattoo removal creams are available but aren't as successful at removing tattoos as other therapies. You can use tattoo removal creams at home by rubbing the cream onto your skin where you have an unwanted tattoo. Most tattoo removal creams contain acids that can irritate or damage your skin. Tattoo removal creams work slowly, so it could take several months of regular use before you see results. Before your procedure, you'll meet with a trained, certified physician who will evaluate your situation and inform you about the process. They'll evaluate your skin and may ask questions that could include: when did you get this tattoo? Have you undergone any prior tattoo removal procedures? Was the tattoo applied by an amateur or professional? Your provider will also measure the size of your tattoo and they might take a photo of it to record the results of your procedure. Your provider will choose a treatment plan based on the type and color of ink in the tattoo and the depth of the tattoo pigment in your body. During a laser tattoo removal procedure, you can expect the following to happen. You'll wear protective eye shields. Your skin's reaction to the laser is tested to determine the most effective energy for the treatment. The treatment itself consists of placing a hand piece against the surface of your skin and activating the laser light repeatedly, pulse, over the surface of the tattoo. Smaller tattoos require fewer pulses and larger ones require more. In either case, the tattoo requires multiple visits for treatments. After each treatment, the tattoo should become lighter. After each session, your healthcare provider will give you instructions about how to take care of your skin. Why does it take more than one session to remove a tattoo with laser tattoo removal? It takes more than one session to remove a tattoo because when you got your tattoo artist applied the ink in layers. Because lasers break the ink pigment into smaller particles, it then takes some time between sessions for your body to flush out the ink. Your skin also needs time to heal. If you receive laser treatments, the procedure can sometimes cause swelling and blistering and can temporarily alter the color of your skin. Sometimes, superficial scarring may develop or your skin may be permanently discolored. Will laser tattoo removal completely remove my tattoo? Each person's tattoo removal process is different. It's relatively common for tattoo removal to not remove a tattoo completely. But some tattoo removal procedures will completely remove the tattoo from your body. When tattoo removal isn't 100% successful, some colors of tattoo dye resist removal, and some pigment is too deep for lasers to reach. For example, certain colors may be easier to remove than others. Blue or black tattoos respond well to laser treatment because they're better at absorbing light. How long does tattoo removal take? Each type of tattoo removal takes a different amount of time depending on the size, color and location of your tattoo. It could range from a few minutes for laser tattoo removal or a few hours for surgical excision. You may need several tattoo removal sessions, especially if you choose laser tattoo removal. It can take between 6 and 12 visits and sometimes more before you see results. How do I take care of my skin after tattoo removal? Your healthcare provider or surgeon will discuss instructions on how you should take care of your skin after a tattoo removal procedure. Immediately after treatment, you can apply an ice pack to soothe the treated area. You may need to apply a topical antibiotic cream or ointment to your skin. You should use a bandage to protect the site. You can shower the next day, but it's best to avoid scrubbing the affected area. You should also cover the treated area with sunscreen when you go outdoors. Try not to pick at your skin after treatment because it could lead to scarring. Is tattoo removal safe? Yes, tattoo removal is safe if you get your tattoo removed by a licensed or certified healthcare provider who specializes in tattoo removal. Thanks to newer technology, the treatment of tattoos with laser systems has become much more effective, with lower risk of scarring. Just remember that this advice is in general and shouldn't replace your provider's guidance. For details about your specific case, arrange a visit with a healthcare provider who's experienced in tattoo removal. What are the benefits of a tattoo removal procedure? The benefits of tattoo removal include: effectively get rid of unwanted tattoos, improve your appearance and self-confidence, limited recovery time after laser removal, a minimal amount of pain or discomfort. It's relatively safe. What are the risks or complications of this procedure? As with any procedure, there are potential risks associated with tattoo removal procedures, which could include scarring, infections, skin discoloration, skin irritation or a rash, pain or discomfort. You shouldn't try to remove your tattoo by yourself at home. At best, efforts will be ineffective. At worst, they could be dangerous to your health. Tattoo removal at a tattoo parlor or spa, while perhaps safer than home remedies, still carry some risks. A trained dermatologist can better consider your overall health and more responsibly guide you on the safest treatment plan. Does tattoo removal cause scars? Yes, some types of tattoo removal can cause scars. You can prevent the likelihood of scarring by taking care of your skin after a removal procedure or session and following your healthcare provider's aftercare instructions. How many sessions does it take to remove a tattoo? The amount of sessions it takes to remove a tattoo depends on the size and color of the ink of your tattoo. It's much easier to apply a tattoo than to remove one. For laser tattoo removal, it could take between 6 and 12 sessions before you see final results on your skin. Talk to your healthcare provider about how many sessions it could take to remove your tattoo. Fact Check notes that, the old saying, "Think before you ink," remains good advice for anyone considering getting a tattoo. Body art is more permanent than you might realize at first. Modern laser or surgery methods, when overseen by qualified medical professionals, are safer and better than previous alternatives for tattoo removal. Also, did you know that the worldwide tattoos removal business is bigger and costly than tattoos inking business?